Hello everyone, I am Dr. Priyanka Das, Gynae Laparoscopic Surgeon at Altius Hospitals. Welcome all of you back to our channel. Today I am going to talk about total laparoscopic hysterectomy. Hysterectomy is the surgical procedure to remove the uterus. Need to remove the uterus arises when a woman suffers with heavy menstrual bleeding or painful periods because of fibroids, adenomyosis, ovarian cyst, dysfunctional uterus, or else endometrial hyperplasia. In these women, we always try the other methods to save the uterus. But when medical management fails, the only way to save them is hysterectomy. Uterus can be removed abdominally or vaginally. Nowadays, we have advanced technology to remove the uterus of any size. We call it as laparoscopic hysterectomy. The whole of the uterus can be removed laparoscopically and by using small keyhole incisions over the abdomen. The size of the incisions would be half to 1 centimeter, where we use the telescope to get a crystal clear magnified vision of the internal organs, and by the use of specialized instruments, we separate the attachment of the uterus. If you ask about the safety of the procedure, hysterectomy is a very safe procedure. The post-operative pain is remarkably less. The blood loss is significantly lesser compared to the conventional surgery. The patients are very active the next day of the surgery, tolerating liquid and soft diet. She is fit to discharge within 2 to 3 days of the surgery, and she can resume her work within 3 to 5 days. Hence, the patient satisfaction is very high. So there are a few myths about hysterectomy that many patients come to us and ask before they undergo this procedure. They always put these questions in our website. So the first one is, do we put on weight after hysterectomy? So putting on weight is not per se related to the hysterectomy. It is when the woman does not do any activity post the procedure, they are only on bed rest, or only if the ovaries are removed, that's when the chances of putting on weight is more. Another myth that they have is the recovery time will be very long. So with laparoscopy, the recovery time takes very much less than the conventional surgery, because in conventional surgery we make a big scar to approach to the uterus. Here, with the holes that as I explained already, half a centimeter to 1 centimeter, the instrument size itself are so tiny that we don't need more scar than that. Hence, the patient recovery is much earlier. Few other questions that they have is it going to be very painful? So as I said, the incision size are so tiny that the pain is not like how it is there with the conventional surgeries. Another question that they ask us very frequently is, what happens after removal of the uterus? So after the removal of the diseased uterus, you are symptom free. The only thing that you need to know is you won't be having your periods and you won't get pregnant. Otherwise, you're symptom free. Many women with this question, they delay their hysterectomy. They suffer for 3 to 4 years, become more anemic, and they do not undergo the hysterectomy thinking what will happen after hysterectomy. Nothing will happen after hysterectomy. You will be symptom free. Your regular activity you can resume better. You will be more concentrating, focus on your work, which you were not able to do because before you were suffering with the disease. As we know, laparoscopy is an advanced surgery. To perform the best laparoscopic surgery, we need a well OT setup, finest laparoscopic instruments. Our lab team, with Dr. B. Ramesh as the chief laparoscopic surgeon, we have performed hysterectomy on the uterus of size 28 to 32 weeks. That means up to 8 to 9 months of uterus size with distorted fibroids, and the patient has fully recovered. So all the women out there who are suffering with their diseased uterus, please visit us. You can also check out our website, that is the Altius Hospitals. We have Insta and Facebook pages. If needed, you can DM us. Our team will connect you to the doctors. Thank you. Happy uterus.